Well, we don't like to tell you this, but coronavirus cases in the U.S. are hitting record highs again. 10 states recorded their single highest day increase of the pandemic last week. Now some are calling the Midwest a possible hotspot.
Well, joining us right now is Ashok Rai. He's the president and CEO of Privia Health. Welcome to you. So, Ashok, what's going on right there in the Midwestern states, especially Wisconsin, that's leading to the spike in cases?
Yeah, Wisconsin's definitely, we'd say, probably one of the biggest hotspots in the country, if not the world, with our percent positivity. And in certain areas, such as Green Bay, Wisconsin, where I'm sitting right now, are in crisis because of the number of patients that we have in our hospitals as well.
What do you attribute that to?
You know, it's a combination of a lot of things. If you look at, the surges that we've experienced, we had one significant surge in the spring, which really was due to meatpacking plants and a couple other manufacturing situations. And at that time, we could control that. Number one, we knew where it was coming from, and we had human behavior on our side. If you look at the surge right now, it's about 3 times as bad as it was in the spring. If you look at total hospitalizations, just under triple. And when we look at it, we definitely don't have human behavior on our side. People aren't staying at home. They're not socially distancing. They're having weddings. They're going to bars. And it's really creating havoc for us.
And then you have an election in the midst of all of this that is taking place. What is the biggest concern right now for you, at least in Wisconsin? Is it the hospitalizations?
Yeah, I'd say it's the hospitalizations. And I think, unfortunately, people look at it as, well, COVID's not that bad. And they listen to, some of the political rhetoric around that. Unfortunately, you may not get admitted with COVID and probably likely are not going to have to go to the hospital with it, although likelihood of getting it in Wisconsin is pretty high right now. But it's all the other things that we can't do when our hospital beds are filling up with COVID patients. It's that heart attack, it's that stroke, it's that next baby to be born, it's taking care of you if there was a car accident. That all gets significantly limited right now because we're literally on a day-to-day, sometimes hour-by-hour bed management trying to find beds for patients.
Yeah, October, of course, is Breast Cancer Awareness Month, and a lot of people are alarmed, saying that there are many women who have been skipping getting checked out because of all that has taken place this year. Let's talk about Regeneron for a second here, because the company that administered the experimental antibody cocktail that the president got, and another company, Eli Lilly, well, they've both asked the FDA for an emergency use approval for their antibody treatment. What do we know about this kind of treatment? Has it worked historically?
We don't have a lot of experience with it. I think that's the biggest concern. Even when going forward with an EUA, antibodies, from a common sense standpoint should work well. Obviously, Regeneron has gone through some testing, but it's not definitely in the phases where we would say, we've evaluated it not only from an efficacy standpoint, but the long-term side effects and the short-term side effects. A lot needs to be studied before it's rolled out to a significant amount of people. Obviously, it got headlines today because the president received the medication. Somebody at that time must have thought that was safe, but really the scientific studies haven't been published to the degree that we would normally expect at this time.
Ashok, you are in Green Bay, Wisconsin, and right now it is a chilly 41 degrees. By Thursday, the high in Green Bay is going to be 49 degrees and just continue to dip lower into the 40s. Are you concerned if Wisconsin is already seeing an uptick, what will happen when it gets so cold that people aren't congregating outside anymore, they're staying inside?
Most definitely. It's probably one of our largest concerns. We had a beautiful weekend, probably our last beautiful weekend here in Green Bay. We're within the 70s. And now it's going to get colder and colder. And instead of being on the golf course, people are going to be indoors. And that increases the risk tenfold, if not more, especially if people are congregating with people that they don't normally live with. Those activities, such as, watching a Green Bay Packers game inside a bar, those are dangerous activities right now.
Yeah, especially with the Green Bay Packers starting out 4-0. A lot of people are going to be indoors watching them this season. Ashok Rai, thank you. Appreciate your time.
With 23